Hi, I'm Nia Coop. I'm a research fellow at the University of Manchester. I'm interested in this opportunity because I really want to make a meaningful change to the food system in the context of our anchor institutions. So thinking about schools and hospitals and universities, I think they have the opportunity to lead a culture shift in our food system, which is much needed. Specifically, I'm interested in the hospital food system because of the importance of both health and environmental impacts of the food system there. And my motivations for this are both professional, in that this aligns with my research interests and experience and hopes for career progressions. And personally, I've visited family and friends in hospital over the last couple of years, and I know we can do better than what's currently on offer. In terms of the change, ideally, obviously want to overhaul the hospital food system entirely, but in terms of this piece of work, we need at least a step in the right direction. So I think in terms of environmental sustainability and nutrition of the food on offer to staff, patients and visitors. At a bare minimum, hospitals shouldn't be serving food that's bad for both population and planetary health. So burnt sausages are quite often given as a prime example of this. So I think a focus on reducing meat and reduce plastic packaging as a first step. And this is really difficult because of the different types of catering models I'm aware of across UK hospitals. Also, I'm aware of that removing meat has a potential for the sort of ripple effects across the food system. So it could result in increased food waste, which has already quite a big carbon footprint of the hospital food system, and also broader impacts on food production and agriculture, which I know is highly political. In terms of how my background prepares me to engage with these complex food system challenges, I think my experience prepares me well and prepares me in three different ways. Firstly, my topic knowledge, so my background's in psychology and behaviour change. My PhD was in dietary behaviours and obesity, and this was in low socioeconomic groups, so also incorporating health inequalities. My current team where I work, we're also involved in work looking at how we change healthcare professional behaviours, so I've experience across changing both patient and public and healthcare professional behaviours. Secondly, my research skills, so I'm a behavioural scientist, and the fact that behaviour change is required at so many levels. I think behavioural science is going to be really key to any project looking at food system change. I also have expertise within qualitative research methods and more recently in systems mapping, which is also going to be really important. And finally, interdisciplinary working, I think, is one of the key challenges to engaging with this complex issue. I've worked across disciplines in academic settings, so working in psychology, primary and secondary care, also outside of academia and public health settings, and as a behavioural scientist in the civil service. So as well as working across disciplines, I've worked across levels of seniority and understanding, and with stakeholders as well, so patient and public and staff involvement across a lot of the work that I've done. Thank you.